Hi, Brandon Hepner here, owner and physical therapist of Rock Run Physical Therapy. Today I wanted to go over with you some of the tools that we have in our toolbox here at Rock Run Physical Therapy as physical therapists and providers to help our patients decrease pain and return to function, return to doing the things that you want and need to do and love to do in life. So much like building a home, a carpenter and all the trades, they have different tools, and you want to make sure you use the right tool at the right time to make the job easier. And we have many tools here. I know in physical therapy, some people think it's just exercise, and while exercise is a very important part of what we do, it's not the only thing that we have to offer. Exercise, when we prescribe exercise, we want to make sure we're prescribing the right exercises done the right way in the right order. And so exercises are really important, but it's not the only tool that we have in our toolbox to help you get better. So sometimes people come in and right away they're in pain and can't do some of the exercises. So the first phase of healing is decreasing your pain so that you can start to move and restore function. So some of the things that we have to help with that, of course, are hot packs and we use ice. And both of those things help reduce pain almost immediately. They can increase or decrease blood flow to the area that's painful and can really make you feel a little bit better so that we can start to incorporate some movement and some exercises that are going to heal you overall. We also have electrical stimulation, a set of 4 pads that we'll put around the area that you're having pain with. Kind of the same idea there. It's usually short-lived, lasts for 15-20 minutes up to a couple hours. But again, the whole goal there is to decrease your pain shortly so that we can restore some motion. We have some other things that help decrease pain and help you heal for longer durations. One thing is all of our providers are ASTIM certified. So ASTIM is using a series of tools like these that help mobilize the tissue. So we will run those tools over a problem area to help break up scarring and fibrosis and those things that are causing the dysfunction and the pain that's not letting you move and heal properly. So now we're moving into some techniques that we have that help heal and decrease the pain for a longer period of time. Along those same lines, we have dry needling. So we use needles, kind of like acupuncture needles. It's called dry needling just because it's not an injection where we're injecting some fluid in there. Needles like these, there's some slightly smaller ones and slightly bigger ones. Most of the time as the needle goes in, you don't even feel it. Sometimes you feel just a little bit. It's kind of a little bit counterintuitive. Maybe you think you're going to stick a needle in me and that's going to make my pain better, but actually it does. It's incredible. So we use this on a lot of patients, and most of the time patients are a little apprehensive at first, and then after they have it done that first time, that's all they want to do because it helps so much. A little bit while ago, I had some shoulder tendonitis and bursitis, and I had some dry needling done on me here at the office, and it was almost immediately, as soon as they took out the needles, I had no pain in my shoulder, and I had full range of motion again. It's incredible. Dry needling really works. Another thing that we can help with that can help with pain almost immediately is our laser therapy. So we're using laser light that penetrates the tissue, goes down into the body, helps work on a cellular and molecular level in the cells to help bring in blood cells, that helps take out some bad molecules, bad parts of things that are causing you pain and decreasing the healing process. A lot of times we'll do the laser a little 8 to 10 minute treatment, and almost immediately people are pain-free, or 90% of their pain has gone away. So a few things there that we have to help decrease pain. Another thing that's pretty unique to Rock Run Physical Therapy is we've recently introduced our Butterfly Ultrasound system. So this is live imaging ultrasound, kind of like ladies get when they're pregnant and they have an ultrasound of the baby. So we can ultrasound muscles, tendons, ligaments, nerves, and we can actually do that ultrasound while somebody's moving, and we can see what the dysfunction is and where the problem is. It's pretty unique and pretty cool. Some live ultrasound imaging that we've started to incorporate to get to the real reason of what's going on. Another thing that we have here at Rock Run is we use some blood flow restriction training with these cuffs. So sometimes we'll have a patient that may be heavy, they need to gain strength and muscle bulk, but lifting heavy weights is too much for them. It's too painful. And so we can use, in certain instances, we can use a cuff around the limb to help decrease the blood flow out of that limb. And studies have shown that by doing that and lifting with light weights, the muscle responds as if you're lifting with heavy weights. And so we can really increase muscle strength and bulk by lifting with light weights, using some blood flow restriction training. So those are just a few of the tools that we have here at Rock Run Physical Therapy, in addition to exercise and the manual hands-on therapy that we do to help mobilize joints and muscles. Again, so these are the tools that we have, and it's being able to pick the right tool out of the toolbox at the right time to build that house that separates a good carpenter from a bad carpenter, makes the job easier or harder. With all these tools we have, we can incorporate some or all of those into your treatment to help you decrease pain, restore your motion, and get back to things that you want to do in life. If you have any questions with any of these treatments, feel free to reach out to me via email or call one of our offices. We also have some information on all of these services on our website at www.rockrun.therapy.com. Thanks for joining me.